Welcome, everyone. Thanks for coming. Appreciate you committing time to, I'm going to steal some of the words from an individual I just spoke with, partnering in improving your healthcare system. I'll say that again. Thank you for coming to partner to improve your healthcare system, right? My name is Kai Menser. I'm the executive director here in Atlanta. This is, I don't know, month 8 or so for me. Share a little bit about who I am. I'm an Army veteran, served in Afghanistan and South Korea. Obviously deployed for a good bit of that time there. I'm also a young leader. Right, that's quite obvious. I've had a lot of people say, "Oh my gosh, you're the director. You're too young." I don't think there's an age limit, right, on leadership, but I do think there's an experience requirement. And so I share this not because I'm planning to leave, but I share this because of the experience that comes with my sacrifices over the last 16 years with the VA and 4 years in the Army. I have worked at, this will be my 5th medical center. The benefits of that for me are that I've had the experiences of other healthcare systems. I've gone through some troubles, I've gone through some positives, I've seen what works and what doesn't, and I've built a large network across the VA of leaders who want to help support not just me, but the healthcare system that I now work at, the Atlanta VA healthcare system. So, I want to talk a little bit about our growth in Atlanta. So Georgia is growing. That's no different than this healthcare system. Last year, we grew by about 1,000 new patients a month. So that's net new. So that's in addition to maybe the veterans that left our healthcare system to move to other states. We added 1,000 new patients a month on average. So we are now the largest healthcare system in the country when you look at the number of customers, so the number of veterans, and I take that very seriously. To me, that's an important factor when I'm speaking with my veterans and getting the feedback from them, when I'm speaking with my staff and getting the feedback. I feel like I have a bigger voice when I get to the table with some of our Washington, D.C. leaders, some of my chain of command, and sharing what's happening here in Atlanta. And what I've discovered is when I speak up, it's happening elsewhere. And so it's the feedback from these kinds of conversations and these kinds of meetings that helped me to do that and permitted me to do that. The other thing that I'd like to talk about, and we're going to get into a little bit on the specifics, is some of the improvements that are happening in the healthcare system. So generally, folks think that the town halls are intended to address problems. Yes, that is what we do. However, it's not the only reason for a town hall. Sharing information, receiving information, and then collectively taking that information and improving so that the next conversation we have addresses those concerns and or in the interim addresses them. But ultimately, the next conversation doesn't need to include those because we've addressed the challenges and we're moving forward. So we're going to talk about community care improvements. This organization is not perfect. This organization is not perfect. We do not have a perfect organization. We have 5,099 employees with 5,099 opinions and 5,099 ways of really taking feedback and functioning in their positions. And I recognize that. We are all human beings, and so we are not perfect. However, my goal is to be better today than we were yesterday, right? I'm not so concerned about what's happening in other healthcare systems as I am in, are we improving upon what our challenge was yesterday today? Are we working on becoming a better organization for our patients? Okay, so we're going to talk about some community care access, and we're going to talk about primary care access being some of our largest organizational challenges, but also some of our largest improvements that we've been making in the last few months. So I will remain here, but we're going to turn it over to Dr. McCullough. She's our Associate Chief of Staff, acting as the leader in primary care right now. So she's going to speak to some of the primary care on provider recruitment, our partnership with the Clinical Resource Hub, and then some of the opportunities we have and some of the unique things we're doing to improve access for those 1,000 new patients a month. Dr. McCullough?
Thank you and good afternoon. Again, my name is Dr. Dawn McCalla. I am currently assisting with the primary care team for this short season. I want to thank each of you for being present here today. Your service to our country and just being here is invaluable. I want to let you know that as a primary care team, we are certainly committed to working with you, as Mr. Menser mentioned, to improve our access in primary care. And what that means is that we have a very, very committed leadership team, not just in primary care, but at the executive level with Mr. Menser and his team. And that bodes well for the slides. I only have the one slide, but as you can see, our first point is that we are actively recruiting and onboarding new providers. That's super important. Most recently, we have received approvals for over 50 providers. And that says a lot for our access because that has been tight. I'm sure you can attest to that. And so by us being able to bring in more folks to help you and to treat our patients, you will have more access. So we're super excited about that. We do have our clinical resource hub. That's what CRH is. And they're our virtual partners. And we're working handedly with them to also see more patients. We have about 3,000 new veterans that will be able to be seen in this upcoming several months because of our partnership with this group. And so that will also be able to open up access. And then finally, we have, in a select few locations, we have some Saturday clinics. We are at this time utilizing that for new patients to come on board because we know that there has been a wait time for new patients. And so we want them to be able to be seen so that we can take care of them, get them into the specialists that are needed, and just address whatever concerns they have. And so at a select few locations, we do have some Saturday clinics, but we can assure you that primary care has ongoing conversations where we are strategizing and finding ways to work with the primary care team and all of our partners around the Atlanta VA so that we can improve the access and care to all of you. Thank you.
Which clinics have Saturdays?
The Cobb Clinic is where we're looking at that right now. We have
Saturday clinics.
Yes, we have fee providers. So those are kind of what we would call on the outside, like our locum providers. They come in and they have been able to help us in seeing some new patients. We do have some wait times for new patients, and they are assisting us greatly with that project.
So one of the things my public affairs officer asked me if I'm going to MC this. I don't plan to MC it. Go ahead.
Oh,
Yeah.
sorry.
I don't want to MC it, but I want to share as a veteran, what I think is important. One is leadership matters. And Dr. McCullough has done a great job as an acting leader in primary care in owning some of the challenges. A week and a half ago, we had a national presentation with a group where they looked at our wait times in primary care compared to the community. And one of the data sets that was brought to us was that, and we look every morning at the length of time that it's taking to see those patients who arrived at the hospital today. And so on November 20th, it was 20.5 days. So that's one of the lows that I've seen. And it's the patients that show up that day. So how long did those patients wait? Today's patients this morning at 8 a.m. were waiting on average 43.5 days. The data that mostly surprised me as a new Georgian was the wait time in the community of 112 days. Right, so it's not, I think it's often important to share what's happening, the perspective of elsewhere. It's not only the Atlanta VA healthcare system that's struggling with hiring providers and getting these providers to come to Georgia. It's in the community. So some of the things we're trying to do is increase the benefits for these providers, decrease the complexity of the workload to help streamline the conversations because of the quantity of things that they have to ask me as a patient when I show up that aren't asked in the community, but we're required to by a congressional mandate. We're trying to simplify that for our providers to help allow them to focus on the patient that's in front of them. And Dr. McCullough is helping us to walk through that. So next we have our new Leadership Matters, our brand new Associate Director for Access. So Atlanta being one of the larger sites in the country, someone in my network had a role that was called Associate Director for Clinical Operations. And I asked, what was that? And they said, well, that person focuses pretty much on access. So when a patient has a need for care, that leader focuses on how do we get them that care the quickest, the most qualitative approach that's going to make a difference for them, right? And so we have a new Associate Director for Access. The position itself has been vacant for multiple years, but we've redesigned it to focus entirely on access. So as a patient, when a consult comes in for one reason or another, and or you're a new enrollee like me, right, you're going to get filtered through one of Miss Lee's departments. So we have one centralized leader to oversee all access-related needs within our healthcare system. So I'll turn it over to Miss Kendra Lee as I kind of puff her up a little bit. She has been here for about 1 month.
30 days.
30 days, there you go.
Good afternoon, everyone. My name is Kendra Lee. Had I known that they were sharing my photo, I would have dressed the same, so I apologize. I look a little different. Oh, you can go to the next slide. It's on one slide. All right, so since I've already been introduced, I'll just tell a little bit about myself. So again, my name is Kendra Lee. I'm coming here from VA Bedford. I've been at a number of VAs, so I'm not new to VA. I'm very dedicated to our veterans and their care, so I'm excited for this new role and all that entails. A lot of what I'll be doing is managing our business office. I'll manage our outlying sites of care, east and west, as well as our GPMs and our community care. And then we'll be standing up a data management team, which will help us manage all of the access to care concerns and make sure that we're working in the right way. So I wanted to start off and talk through some of the exciting things that we've done this year for our veterans. As it relates to our wait times, as you can see, we've been able to reduce our wait times in community care for all three major areas of care that we provide: mental health, primary care, as well as specialty care. In the last 2 months, we've been able to process over 56,000 medical records and 2.7 thousand requests for additional services. So that's a lot. And as you know, Atlanta is growing. We are the largest VA healthcare systems within the VA. So that's a lot. With the same amount of people that we've had, we're looking at, of course, increasing the number of staff that we have to support our initiatives. Additionally, we are scheduling faster despite absorbing 23.7% increase in veterans, and we have an approximate increase of 23 to 24% annually for emergency room and emergency care in the community. So there's a lot that we have going on. Sorry. Additionally, with our contact center and My Healthy Vet secure messaging, we've handled more than 88,000 inbound calls to community contact center, and we've answered more than 35,000 secure messages. We're also very excited about taking care of our women vets, and so compared to last year, we're approximately 2,000 more women vets are seeking care here in the Atlanta VA, and we're excited about that. So that's about 12,677 women vets receiving care in the community in FY24. And so that's pretty large. So I want to thank all of our staff for all their hard work in improving this, and we're looking to continue this into the future. This year, our goal is to expand our access to scheduling within the community, so it makes it easier for our veterans. And we're also looking to improve care coordination, and we're going to do that, of course, by increasing the amount of care coordinators that we have on site to help our veterans. So thank you for the opportunity to be here and provide more access to our veterans. Over to you, sir.
Thank you.
You're welcome.
Can you go back one slide? I want to make sure we iterate this, right? For the folks that are on the call and in the room, the top three bullets, right? And I'm a simplifier. I often think of myself as a translator. the time it took our team, your team of schedulers in community care. So for mental health, they went from 61 days, it took them 61 days to get a hold of somebody in the community and make an appointment happen for you as a veteran. Now it takes them 28 days, right? And they're not done improving. Same thing with primary care. They went from 34 days, right, from the day they got that until the day they actually had that appointment scheduled. Now, there's a lot involved in this, right? Our community partners have to pick up the telephone and they have to say, yes, I will see your patient. They have to say, yes, I have access, right? So there are often times that we call our community care partners and they say, well, we don't have any access. And we move on to the next one, and the next one, and the next one. And it takes days, right? Sometimes weeks for them to get back to us. And so you can see the gap there, 34 to 23 days, and we're not stopping, right? Our goal is to continue to improve, to be better than we did yesterday. Specialty care went from 52 to 41, one of the hardest things in the country to really focus on. And this is there's a lot of specialties within this bucket. But it took me 6 months to get into dental in the community. I don't get my dental care here at the VA, right? It took my wife 6 months to get it in the community. So that's rolled up into this with those providers in the community and how much capacity they have as well. So I really just wanted to focus on those three improvements which directly impact, right? A lot of our patients get community care. Almost, what's the percent, Danielle? 24% of our patients are utilizing community care for something. So 1 in 4 patients walking around here are going through these 3 buckets. Go ahead, sir.
On that note, is it that the providers on the other side are turning you down for that request for reasons?
So the question from the room from one of our veterans is, for those 3 buckets, is part of that challenge the providers turning us down for that request? The answer is yes. Yeah, so let me have Danielle come up. She is, not only is she also a veteran, but she served in our leadership team for a while, and she is the chief of our community care department. So these improvements were driven by leadership in Ms. Terrell. So I'll let her speak to some of the mic echoes if I use this. So you use.
I'll use this one. Okay, thanks, guys. So I'll say it's multifaceted, right? Sometimes it's the amount of time it takes to review the clinical documents and the request ages out. They get so many days to do it. Some of it is the community providers don't have schedulers. So you have to wait for the doctor to finish seeing the patients and then review our cases and then review our clinicals and then try to get back to it. Some of it is they're communicating with us on fax machines and we have to sort through all of the incoming faxes. It is a very complex system. And so one of the goals are to have our major medical centers enrolled in medical record sharing. So very happy to say Piedmont and Wellstar and Emory are all now using medical record sharing as of very recently. So now we can communicate with them through a portal. So we're trying to work through a lot of technology solutions so that it's less manual in the process. So it's less phone calls and emails and all those types of things so the providers can get directly to us.
Thanks, Danielle.
Yep.
As you can see, we've got all the experts in the room today to help be the experts for the answers. So next, we're going to have a very important topic. The VA, not Atlanta, the VA decided to change the way for our veterans, for you and I, to be able to sign in to My Healthy Vet, okay? So we're gonna have Mr. Burton, our expert, speak to us a little bit about the new sign-in process for My Healthy Vet.
Thank you, sir. And thank you all. And if you look at that slide, before we transitioned to secure sign-in, I actually had hair. So now, thanks to secure sign-in, I don't. And on that last slide, community care answered 35,000 secure messages in FY24. In FY24, primary care and JMC as a whole, we answered 517,000 messages from our veterans. Wow. So, and we want to increase that. And the reason we want to increase that, because that's going to decrease your walk-ins, decrease your phone calls, decrease clinic congestion, ensure that you get provider contact on the other end. Now to secure sign-in and how this impacts you. So if you notice My Healthy Vet over the last few years, everything has changed to more secure portals. You have myhealth.va.gov and you have My Health, which is our Oracle healthcare system. But in the background, you don't notice all those changes. So now everything is changed to id.me and login.gov, which are not VA-centric programs. Those are national programs, as Mr. Mensa mentioned, way more secure. However, it's way more cumbersome. So January 31st, 2025, any veteran that haven't transitioned to a id.me or login.gov account would not have access to not only secure messaging, but appointments, pharmacy, all those critical results that we want to when we're talking about labs. So what are we doing as a medical center? And we're doing great things. Our director, Chief Nurse Dr. Miko Singh Anderson has headed this. We're at every single CBOC waiting area. We're trying to get the word out. You've probably received a call from Audio Care informing you of the secure sign-in process. It's cumbersome, but we're here to help. Okay, so you create an account on id.me, and if you can't, believe it or not, the USPS system, where there's a passport center, can transition your account. Okay, so any post office with a passport center can transition your account. However, if you do not have access to that site, we're reaching out. Okay, when we first started this, I want to say mid-November, we had 61,000 veterans that haven't transitioned over. As of today, we have 35,000, a 42% decrease in that. So what we want to do is get that number down to 0 or less than 1,000. I prefer 0, and this is what we're doing. So again, the handouts are in the back. My name is Michael Burton. I'm here to assist. I'll still be in the back if you have any questions. You will receive information on any appointment cards that's going out to our veterans. The information is there. Handout is at every single CBOC. You're going to receive the calls. And you still have access to us right now in secure messaging. We're sending out secure messaging as well. Thank you, sir.
You said 35,000 still remain?
35,000, yes, sir.
So the importance of the 35,000 veterans is that you won't be able to talk to your providers. But let me be clear, right? My Healthy Vet is not the answer to talking to your provider, okay? So I'm a veteran, and I want to be able to talk to somebody sometimes. I love My Healthy Vet as a veteran, right? And when I get a sinus infection, I just write to my doctor, they give me some amoxicillin, they say, hey, look, I know you go through this every 3 or 4 months. It's phenomenal. I can work through it, I can go get my meds, but there are times that I actually want to talk to somebody, all right? And so we're working on that as well. We've got a one-pager that a lot of you have in your hands. We have a new clinical contact center at the VISN that is hiring staff every day, nurses, schedulers, and pharmacists to be able to speak to you as well, okay? So My Healthy Vet is, we call it access. We absolutely do, which is why we're emphasizing it on a town hall, because it is access, right? We don't do great at it either. And here's what I'm talking about. When I teams my provider on My Healthy Vet, we're expected to respond, right? Less than 3% of the time. Less than 3 days.
Yes.
Right? Unfortunately, 9% of the time that doesn't happen. And our goal is less than 3% of the time, right? So in an ideal world, we would meet that measure every day, right? Personally, I don't want to wait 3 days to get my amoxicillin either, right? So I'm like, I want to hear it in 3 minutes, right? So that is my goal, right? Is that we get same day communication. But remember, primary care has more than 50 vacancies. So we are good stewards of the government resources. Those 50 vacancies are validated through productivity. We need them to see you as patients, okay? So what that tells you is we've got a pretty large gap in our primary care department. So I'm very cognizant of trying not to burn out my primary care providers that I have here and say, hey, my goal is 1 day, right? When they're trying to keep their head above water as we continue to try and recruit these providers in the community. And it's like you heard, right? It's a community challenge. okay? So we're really going to work through this. My desired goal as we press through this year, though, is that we get those 35,000 veterans enrolled in the appropriate login or ID me for My Healthy Vet so that we can continue to track and communicate with those patients. Thank you, Mr. Bird. I really appreciate you coming up. All right, we have one more update, and then we'll do some Q&A. I want to hear from you as patients and as veterans. So we did have a VBA leader, Ms. Sealhammer on board. She emailed me just before. Thank you for coming over, sir. She had shared that she's working through some challenges right now with the continuing resolution that hasn't quite passed yet for her and her team. I can assure you that here at the hospital, that does not impact us. Our staff will be back to work. Continued, our funds are provided years in advance, and so it's not an impact for us here in Atlanta. But Ms. Sealhammer is working through some challenges. So in exchange, we've got Bryson Stark. Brian, sorry, Brian.
Sorry.
I added an S in there, apologize. We've got Brian Stark, the Assistant Veteran Service Center Manager. Thanks for coming over, sir.
Well, thank you, everyone. I just want to first thank you for your service, and just want to welcome you to this event. Thank you for inviting us. We've got two managers in the back. If anyone has specific claims-related questions and we're unable to answer them at the Q&A afterwards, we've got two individuals, we've got two managers that hopefully they can help. If not, we'll get your contact information and get back with you. So I'll kind of go through these slides and hit on some highlights. And like I said, if you got any questions afterwards, we can kind of go through them as well. So far as this is some of the data as far as our claims processing. We've got roughly around 700 VA employees that process VA benefit claims. And this is some of the data since October 1. As you can see, we've processed over 31,000 rating claims alone. And we're trying to do, this is what our goal this year is the year of quality. So we're trying to do these claims processing with the very utmost quality at the forefront of what we do. So we're taking our time, we're making sure that we're doing these correctly, because if we do a rating decision, it impacts everyone that's sitting in here. It impacts family members, so we want to make sure we're doing it right. Okay, next claim. Our next slide. So these are PACT Act. So PACT Act legislation, August the 10th, 2022. So this is some of the data for Georgia-specific PACT Act veterans. So what you see here is distinct Georgia claims. Now, we don't work all of Georgia veterans across the street. We have a national work queue. So based on capacity, those claims are distributed nationwide. But as you can see, there's been 86,000 Georgia veterans that have been impacted by the PACT Act legislation since 2022. And as you can see, the net, these are the retro benefits that were awarded, $350 million just to Georgia veterans alone. Think about that. Great legislation. It's impacted so many veterans. Hopefully, some people in this room right here was able to benefit from the PACT Act legislation. That's what we're here for. We're here to grant claims. We're not here to deny. We're here to grant claims, but we also have to make sure we're following the legislation. Next slide. And these are some of the more frequent grants that we granted due to PACT Act: allergic rhinitis. We've got some heart elements. And as you can see, this is what I will tell you sitting in this room today. If one of the PACT Act items or some of the claims are not included right now, and you feel that, hey, listen, I still think this was due to the PACT Act or it was due to Southwest Asia service, file that claim. File that claim, get that placeholder, because down the road, a year or 2 years down the road, you never know when they're going to go back and revisit. And they revisit based on claims that are filed, research. So I implore each and every one of you, every time I go out to an outreach event, someone comes up to me and they'll ask, hey, should I file a claim for this? File a claim. Always file a claim. Even if it's denied, you always have that placeholder. Next slide. And these are some of the, like I mentioned before, see, these are some of the new things that they're looking at. Bladder cancers, chronic multi-symptom illness for K2 veterans of CARSHI, Canaban base. So based on a lot of the research and a lot of the claims that have come down the road since August 2022, they've able to put more, or open up the tent, so to speak, when it comes to these claims. So I implore you to file a claim if you feel that it's one of those issues. Okay, next slide. Automatic decision support. I don't know if you all know, but we're not in the AI world just yet across the street, but we're slowly getting there. Automatic decision support. So these conditions on your left-hand side here are currently, whenever you file a claim or a veteran files a claim for any of these conditions, it goes through this ADS program. So what happens is all the development's done up front, the exams are scheduled up front, and once the evidence comes in, it goes to a claims processor to review. So it eliminates a lot of our claims processors having to go through that development process. So that being said, it's not fully automated because it still has to go through a claims processor to review to make sure the information is correct. But we're getting closer to where a lot of our processes are being more automated. And that's going to help you as the veteran get more, not only more timely decisions, but more accurate decisions. Because that's what we're here for. We're here for accuracy first and foremost, but we're also here to process as many claims as we can timely. Next slide. Okay, so this is some information in regards to our public contact. I was talking to Pamela, is that what your name? There you go, raising your hand. I was talking to a veteran earlier, and I was just letting her know that, hey, listen, we've got claims processors, we've got public contact representatives across the street 5 days a week, taking veterans' inquiries, seeing veterans face to face, helping veterans. So if you have a question that you cannot answer, even if for some reason we cannot answer it today, you can go across the street and talk to a representative. There's service officers located across the street as well that assist with the veterans. We have claims clinics once a month. We have virtual claims clinics where by appointment, we line up appointments because we want to make sure we have as many employees available. And generally the claims clinics start around 4 o'clock in the afternoon and go up until 6 to 7 o'clock at night. So we had one yesterday, I believe it was yesterday. We had 71 veterans that we assisted in the virtual claims clinic. And we're doing that monthly. We're doing it monthly. We also are all around the community. We're trying to reach veterans where they are. We're trying to reach veterans in locations in South Georgia, Dublin, North Georgia, anywhere a veteran is not represented or not served by us, we're trying to go out and reach them. So just kind of keep that in mind. We're here for you, and hopefully, like I said, if you have any questions that I can answer or if our two managers can answer today, we'll get your information and get back with you. Next slide. That's all I've got. Appreciate your time.
When's the next claim minute?
Virtual claims clinic?
Oh, it's virtual.
It is virtual, yes. Now, we did every quarter, and we had one in November. We had actual in-person claims clinic, so where we had it during the week.
Check 1, 2.
And we saw over 108 veterans. We saw over 108 veterans at that claims clinic. And it was during the day. It was. I believe it was on
Check.
Wednesday. Wednesday, I think it started around 9 o'clock in the morning. It lasted all the way till 3 o'clock in the afternoon. So whenever we have one of those events, we try to get it out on the websites, and we also try to publicize it as much as possible because we want veterans to come in. So we don't have one lined up right now as far as a next one, but we will have one probably the next quarter. But we do have virtual claims clinics each month. Thank you.
Thank you, sir. Do you know when the next virtual is? Did you?
I don't think it's been set up just yet, but one of the things we want to try to do is communicate with you all, so you all have the information. So if I don't know, if maybe we'll get a point of contact over here and let you all know, that way you can
That'd be
pass
great.
along that information.
So we can
Yes.
start telling our staff that see, 1,200, 2,000 patients a day, that
Yes.
opportunity. Yep.
It's usually Tuesday or Wednesday during the beginning part of the month, because we want to try to have as many veterans as possible. But it's usually during the middle of the week. Thank you.
Thank you, sir. So just because you don't raise your hand now doesn't mean you can't ask a VBA question in a minute. So this is something that I take a little bit of a unique approach to a town hall for. Well, first of all, there's a couple of reasons for it. One is I don't want to waste anyone's time, right? So what I'll see a lot is someone will bring up an issue or a challenge, and that individual could speak for 10 minutes, right? And then I've got 15 other, 20 other, 50 other, 300 other veterans on our Teams call listening for 10 minutes, and there's not enough time to get to everyone's. And so what I want to do real quick is for my VA employees in the room, right, and then the benefits employees in the room, if you could just real quick stand up, shout out what you're here for, what you're representing, and here's why. Okay, so I'll give them a minute to think about what they're going to say. I want you to be able to go to them and get your challenge resolved, okay? I will hang out, I'll be here, right? So you can always speak to me, but I can't help you with the VBA claims, right? So if you're talking about your service connection for something, I won't be able to support you with that. But we do have experts here who can work you through that, okay? And the other thing is, I am responsible for your information. So there's 300 people online possibly. I don't want you to stand up and say, Chi Menser 1467, it's a made up social security number. That's not really it, so don't try it, right? I don't want you to stand up and speak to a very specific thing about your health care, because I don't want that to get out into the universe. Okay, so part of it for me is I'm responsible for that while you're here. And so part of it is for the experts in the room, for them to hear from you, you can give them those specifics, for them to give you a specific answer for whatever it is you have. Okay, so real quick, let's go around the room and see. Go ahead, sir, in the back.
Just to answer the question Brian had for the next virtual claims clinic, January 23rd.
Next virtual claims clinic by one of our VBA reps is January 23rd. 2025. There you go. 4 to 6, sir? Ish?
To be determined, but usually, yes.
Usually 4 to 6. Okay, so for those on the line, those in the room, January 23rd.
Thank you, Michael.
Michael,
You want to introduce yourself?
there you go. Go ahead.
Mike Stradling, I'm, like Ryan says, I'm a manager next door at VBA. Did I need this?
No.
Okay, I thought I was loud enough, but thank you. For the people online. Okay, for the people online, Michael Stradling, work for VBA next door. Currently a manager, but I have been a claims processor for 10 years.
Good afternoon, everyone. My name is Lauren Burford. I, too, am a manager over at the Benefits Office. Sorry. I have been a claims processor. I'm also a veteran. I'm here to assist you, give you information, or at least guide you with your claims.
All right, let's hear from my VA team. Who do I have in the room from the hospital? There you go.
I'm Lauren Rushin. I am the PACT Act coordinator for Atlanta VA Healthcare System. So I'm here to answer any questions regarding toxic exposure screening or challenges or concerns related to exposure-informed care. Thanks for being here.
Thank you.
I'm Indira Brevik, and I'm in the Caregiver Support Program. I can answer questions about how to apply, what eligibility requirements there are, how to appeal a decision that wasn't satisfactory. Thanks.
Hello, everyone. I'm Nakia King, excuse me, getting over a cold. I'm one of the assistant chiefs for the social work service line, and I also work with caregiver support, so I'm here to answer any questions you may have regarding that program, contract nursing home, or a medical foster home. Nakia King.
Hey, this is Kim Whitmoyer. I'm the Chief of Social Work. This is Social Work Lane right here. I think, so, thank you.
Hi, my name is Dorothy Johnson. I am with the Women's Veterans Program. I'm also Women's Health Liaison Co-Chair. Here to assist you with any questions that you might have with Women Health Services, and I will also help you to move through the system a little bit easier, so you'll always have a contact. If you need my number, 404-436-3205. And again, I'm for Women's Health. Thank you.
Good afternoon, everyone. I'm Angela McCrory, Chief Veterans Experience Officer. Anything from the front door to the time you leave, your experience, your trust in this VA, and I'm over the patient advocates, and I have patient advocates in the room if you have questions.
Hello, I'm Beck Bradley Davino. That's a mouthful, but I am usually the mental health chief, so I can, of course, address those questions. Today, I'm also the acting chief of staff, which means questions about your health care in any part of our system, I'm happy to help address.
Hello, and again, I'm Dr. McCalla. I am currently regional, but I have been assisting as deputy chief for primary care. So anything that you need in terms of primary care issues, access, all of that, I'm here to help.
Thanks, Dr. McCall. Anyone else? I've got my chief of community care. You guys know that. I've got my chief of my associate director for access. You guys know that. My communications chief over here in the blue. My associate director for operations in the room. So anything infrastructure, building. I've got my assistant director in the room. So interior design, paint, wall colors, all that. And my associate director for patient care services. So the highest nurse of all nurses in my healthcare system here in the room with me. And then like she's got her beauty wave going on. And then a spattering of other leaders in the room. All right. So I've shared who's here. What I'd like to do now is see if there are any specific questions or comments that you'd like to share with us as a room. And then I see a lot of hands raised. So let us work through, if we could go from right to left to share with, and please don't share anything specific about your.
Okay, this is one of my questions. How would us as veterans know that there was a town hall meeting today? Because I went to every desk on the first floor. I had prior knowledge of it, but no one at the information desk, nor the operators know, they didn't have any information on it. That's why you only got about 20 veterans in here.
That's good feedback. It's great
No,
feedback.
so my
'Cause
question-
I want more people.
No, I know you want, but
Yeah.
so why didn't we get the word?
Well, it sounds like to me that the leaders of those areas didn't share with the staff is my suspicion. And I said leadership matters. So we talk about it every day and have talked about it. What we'll do though for the next one is ensure that we print out those flyers and put it on those desks for folks to see. I know social media is what some folks in the room want to say. I know we don't always follow that. And I know some folks will say, well, we told every single employee, but to me, there's two sets of failure, and every time there's one failure, and one of those is usually leadership. So we'll make sure that we get those printed out next time to get more attendees in this room.
I got another comment I want to make.
Thanks for the feedback.
It's very dangerous. I keep getting wrong medicine in the mail. Other people, that's right. Other
Wrong
veterans.
medicine?
Yes. At one time, I was taking the medicine until I realized my name wasn't on the bottle. And I get eye drops that are supposed to be delivered in a cooler. Sometimes they show up just in the mailbox.
All right.
I'll bring them down and show them to the pharmacist. They say they should have been cool. I know that. That's exactly what to say. So they go in the back and give me some more and still not cool.
All right. So I do need some specifics, but not right now.
Well, I'll give them to you.
Yeah. So we can track that because
One more thing. Now, that's my talk.
That's good.
My primary care doctor, a while back, would show me that I had to move my knee 3 times a day because I had a problem with my knee. I went to a civilian doctor. I asked him, do I have Baker cyst. He looked at it and said, I have a Baker cyst. So he sucked all the juice out my leg, did some scans like they do the women with the babies. What do you call that? Ultrasound and some other thing. And he showed me that I had problems with my knee. He gave me 2 shots in both knees, and it fixed it. But I've been going through stuff with my primary care doctor a long time. You know, it's a long time, and I shouldn't be, no, we're not getting treated right. It sounds warm and fuzzy when y'all talking here, but when we dealing with it, it don't work like that. I got a problem with my shoulder. I went down an airplane in 1985, documented, problem with my shoulder, 1985 now. This doctor want me to keep taking Motrin. I said, I'm not gonna take any more Motrin. I'm gonna kill my liver. There's not one VA doctor or not one VA nurse had me take off my shirt and look at my shoulder or my neck. Nobody looked. I went to a civilian doctor on my own. They looked at my shoulder. They said, I need surgery. Not Motrin, I need surgery. So I go back to my doctor, told her what it, I gave him the paperwork. Then she sent me to physical therapy. Like, okay, I do what you tell me to do. And then the physical therapy, the first person looked at me and showed me in the mirror how to look at my shoulder, there was out of line because some muscle pulling. But no VA doctor have never looked at my shoulder. And I went down in a military airplane in 1985. It's in the records. See, that's not something just is missing. Dental work. Since 1995. 2 different dentists. They ain't got it right yet. I finally got some parchment in my mouth. On the top. To a civilian dentist. All this paperwork, back and forth, back and forth. By the time they get to where it need to go, he find other damage that should have been repaired a long time ago. Teeth has turned around, one go too long, no spot on the bottom. And he started working, he said there was a cavity. With the cavity, he got to get permission from somebody, and that takes months and months and months. I came to him, Mr. Mark Jenkins. Whatever he did, he got on the computer, and it got fixed. But everybody just spin me around. They say nice things to me. I was supposed to go to the pain clinic. Go to the pain clinic. I'm talking funny because I do teeth in my mouth. I go to the pain clinic to ask the question when I need physical therapy. They said you were scheduled. They had set me up like for March. With my son. They had from October some kind of way to March. And then that got counseled by somebody. Then it's been rescheduled to June. That's a long time to get to the pain clinic when I got pain.
I agree.
But no medical professional in this building or at the clinic have put their finger on my neck and push where I'm telling them to push. And I said, I'm not going to take any more Motrin and kill my liver. Wait a minute. I served 25 years. I paid the cost. I'm a retired Navy chief, and we get it done. We don't skip around. When we got to make a mission, they don't ask me, can you make the mission, chief? No, we're going to make it. Everyone. Because I did it. You understand? But we come here, when veterans come to the VA, this is what we look for. I don't mean to take y'all time, but I'm talking about y'all too. When soldiers come to the VA, and we looking for our first sergeant, that's what they call them in the military. When we come to the VA, we look for our chief. The chief is the person in the Navy, or the first sergeant in the Army, Gunner Sergeant Marine Corps. We're the one that make it work. I can't find a chief in here. Soldiers can't find no first sergeant. Marines can't find no gunnery sergeant. That's what we're looking for, because that's what we used to. Because I was the chief. And they know I'm telling the truth. Is I'm telling the truth, y'all? Yeah. And you know how you get all this stuff fixed?
Yes.
Hold everybody accountable for their job.
Yes.
Make them get off their cell phones.
Yes.
People all the time work around there on a cell phone. You got to stand there and knock on the desk. They say, excuse me, birthday party week? Will I get my hair, get my nails done? I paraphrase that.
Yes.
They talk about it too. I'm saying, it sounds warm and fuzzy in here, and everybody knows what I'm talking about. Most people are afraid to tell the truth. But I'm sick and tired. I've been going through stuff since 1995. I retired at age 43, now I'm 73. Still trying to get my stuff done. That's a long time.
Thank you.
I'm sorry, y'all.
No, sir. Yeah, before we move on, I want to thank you, acknowledge I may not always use the appropriate words, acknowledge how screwed up that is, right? And assure you that we will work on it. Let me be clear. I didn't say I'll fix it today, right? Because first sergeants, they exist, but they don't change everything in one day.
No, but we do a good job.
That's right.
We get it done.
That's right.
Hey, Chief, we get it done. We get it done. You hire me over here and put me in the department. I guarantee it'll be straight. They're going to answer the phone. Listen, the operator's here. Whoever in charge of the operators, check this out. You call the switchboard, ask the operator questions about this meeting. They don't know nothing. They hit the button, see you to somebody else, you be on the phone 10, 20, 30 minutes, and you lose the phone. Or you get a voicemail that's already full. Yeah. And they say, we back April 3rd. It's like April 3rd, we already gone.
Yes, sir.
So people not answer the phone. Operators say they got the same problem too. I say, ma'am, please, can you stay on the phone with me until you transfer me over there? Can you stay on the phone with me? Make sure somebody's there. They say I do the best I can. Then they say they're not answering for me neither, but I can't hang this long. They can't hang the phone with me 10 minutes. That's why I got 2 telephones. One for the VA, just keep on hold while I'm driving, doing what I'm doing. I got 2 phones. I got 2 phones. This is the VA phone right here.
Yeah, that's.
So I can stay on the line with them.
You got to laugh at that one. I agree, sir. I appreciate you bringing it up. I think what you brought up seems appropriate, right, as it was presented. And I agree. My staff over here said, don't feel bad for bringing this up because somebody posted online, how do we hold staff accountable? We can't hold them accountable if we don't know. And before you jump up and start preaching again, right, let me say, right, leadership is new here, right? And so I don't know, right? I don't know everything. But when I am brought up information, I do hold people accountable, okay? And you were in this 25 years, you said, right? Accountability takes time, but it happens. Yes, sir. Accountability will take time for our staff, but it will happen, okay? As an Army veteran, a sergeant, I didn't make it to first sergeant, right? It happens, and it will happen. I can assure you that.
Yeah, I just wanted to, at this point,
Thank you.
For me, so I just want to add to that. I experienced, I'll keep it simple. I had an experience here most recently, and I couldn't understand the difference between a complaint and an incident report. And consistent with what he's saying, there seems to be a fear amongst your staff here about receiving a complaint / incident report. When I went to one place, I don't want to call departments now because I know who you guys are, I'll come see you. But when I went to one place, they said, well, you have to fill out a complaint over here. And then you have to go back to the department where you had your issue, the ER, okay, I'll say that. And when I got to the ER, everybody just did the song and dance. And never, I say again, never, one more time, never took an incident report from me. With that, I had trauma with my knee. Those new wheelchairs that you got, the word quality applies. I'm a former Ritz-Carlton person. It is not a quality product. You wasted your money, okay?
Big blue ones?
It's not fit for use by the patient. Say again, not fit for use by the patient. And with that, your staff is not trained on how to use it because the lady had me in the chair, she ran me into the wall, caused trauma to my knee. I ended up having to come back here twice to the emergency room. You understand? A lot's going on. And then when you want to give the feedback, because I want to give the feedback to improve the operation. 12 years, food service director. I'm a certified dietary person. So I know the healthcare industry. And I'm from the Ritz-Carlton. They hired me in the hospital to help improve service. Everything you talk about here never mentioned service. And that's who we are. We are the fabric of service to this country. Okay? And I haven't heard. There's a lot of this and that and all that going on, but if you focus on service to the patient, and all of this, I wrote it here, it's not patient-focused. It's not a patient-centered care. Your whole conversation described it that. You have new leadership now 100 years later, you're behind the 8 ball,
Yes. Yes.
okay?
Yes.
And you're still not focused on the patient. When you use him as an example, that's a perfect example. You don't need 100,000 service member who has already died because of the poor service they received here. Not here specifically, but what you owe us.
Yes.
Okay? And when we have to sit here and fight, we've done that already. We don't come home to fight for care. Okay?
Yes.
I met you earlier. I asked you a political question. Y'all got to get rid of that. When we say report for duty, on time, nothing less, nothing more, okay?
Before on time.
You understand?
Yes.
And here we are today. I have an issue. I had not called my lawyer yet because I told my wife, when you take your car to the shop to get fixed, that is not the time to be complaining about the mechanic. And that's what has happened to me here. I told you you need to talk to me one-on-one. There's a lot more here.
Actually, I think I offered to talk to you one-on-one, and you said you'd take me up on it.
I will.
Yes, sir.
There's a lot more. And I'm only shortening this because I gave him all the time. I think he covered a lot there. You understand? But my issue, patient-centered care. Period. 3 words. From the Ritz-Carlton, quality, fit for use. 3 words. Notice, and we drilled it down. 3 letters in each one of those words. And that was designed to teach everybody in the hotel, from the dishwasher to the general manager, we are all focused on quality. It was easy. If I was to ask you the definition of quality, you would have a different word from that lady over there. Focus. Because we're suffering down here. And you come with budgets and things and blah, blah, blah. Sounds good, woman fuzzy, quote unquote. It's not patient-centered. We came in here. All of us are in here. You don't even have a sign-in sheet to say, welcome. But you're taking our feedback. It's almost like our feedback ain't worth a dime because it's not recorded. You know that in the military. Some of us are professional leaders and managers, got degrees. You know this stuff. You get your check. If your check don't arrive on time, you shut it down. But we're in here, all professionals, got a plan, leadership, not patient-centered. Now, I say that globally. Totally appreciate the counts as they go up and down, the women participating, make me smile. Yeah, but we're behind the 8 ball. You can do more. I know you can do more. You just don't want to. You control budgets, data checks, all that. Patient-centered. There's a lot of us here. Why is it only today in 2024 we talk about Saturday service? Hell, we give service 24/7 since George Washington. That's all I got. Take this from me.
Goodness.
Thank you, sir.
I think he deserves a round of applause because he's speaking for all of us veterans. Seriously. And so on that note, my commentary is minimized because this veteran has surmised all of the importance of what we veterans really need. We deserve and we've earned service. My particular dilemma today is that I am here from invasive eye surgery that was done outside of the VA. So I'm actually trying to cosmetically look a little decent, but I should have a patch over my eye. But it was so important for me to get here to this meeting that I only heard about yesterday through a patient care advocate. And the reason I only heard about the meeting today is because I came in to lodge a complaint. And the complaint is that I have not had my earned services through dental care that I've earned and that has been approved. And I sit here with abscess right and left inside my mouth, a tooth hanging out, in severe pain because the community service people and the dental folks don't return calls. They don't recall the 3-day and over mandatory e-message. None of that happens, sir. Now, with all due respect to you, Mr. Metzer, I know you are new on board. I don't know if you know what you really signed up for, but it's pretty bad here. But if you don't get anything out of what we're saying today, please know we just want service and not any kind of just shut me up. No, we want thorough service. That's all we want.
And by the way, telling the staff, they're not sergeants, so they don't talk to us like we're in basic training. Right. We walk around here, some of you civilians, I'll say it, some of you civilians, you don't boss us around. I had to take 5 steps backwards at Arcadia the other day and check it. I'm like, dude, what is your problem? You don't march me. I'm the patient. You ask me. And if I ask you a question, I expect. That situation with the phone today, I told you about.
Yes.
If I'm the one that walked that young lady on the other side, this is how you handle this qualitatively. I put the word down. Y'all use it, y'all qualitatively. I wrote out all the time you use the word quality in here. I was writing.
Yes.
Bunch of words. And all y'all got different interpretations of how to, you don't even know how to enliven the word. Sounds good because we are all educated. But how do we enliven quality? 99% of you all in here don't even know how to get started on that process. You might know how to start that surgery, but the word quality and implemented it in providing service, you obviously are failing, like you say, across America. Okay? So we're focused right here in this micro of Atlanta. You have an opportunity, but back up all this stuff, get some wheelchairs in here that we can use. Simple thing, that's a budget, that's a check, that's a vendor that you already have. Somebody in here does purchasing, or you got to go back, get 100 of them, park them somewhere. Have a in-service is the word we use in healthcare, yes? Okay, I highly recommend that y'all walk out of here today and ensure every nurse in this building understands how to use that damn thing. And according to them, you require staff. I said, so you don't have enough staff, so you go out and you buy you spend $1 million on something that requires staff for you to use. That's smart.
That was smart.
Yeah.
And they're brand new, so that's a check that's recently written.
The brakes in the back.
And the brakes in the back. Lady couldn't help me. She caused trauma on my damn knee. I've been out of work for 3 damn weeks. I'm a caterer. I make money when I sell. Are you gonna pay me back my money? The only way I can get my money back, but look at the route that I have to take. Here I go again, fighting. I shouldn't have to fight. Somebody amongst you guys should call me in the office, take my incident report, figure out how you're gonna satisfy me, and then do it. Let me say it again, do it, because that's the key, is doing. Soldiers, airmen, Marines, and all of us, we do. And if we don't do, we get punished for it. Say again, we get punished for it.
Thank you.
Well, thank you. And again, if y'all, the meetings, the leadership and all that good stuff, I don't know if y'all include people like us, where you get the genuine feedback. That's a step in the right direction, sincerely. And if I could have someone in here today see me, please, about where I need to go for a referral that had been confirmed and now it's somewhere in the air and no one knows nothing, I would greatly appreciate it. Thank
Yes,
you.
we can definitely.
Excuse me, sir.
I'm trying to interrupt, but not interrupt. Yeah, I don't-
I did submit the complaint. Now, where I come from, you submit a complaint, you've got approximately 72 hours to react to this complaint. Especially when somebody's complaining about having had trauma in the ER. It's been a week, 2 weeks going on right now. Okay?
So
Thank you.
I just, no, it's okay. Yeah, it's okay. So a couple things I want to address because it is a large audience. One is we're hiring an experienced officer to help address this and invite you to come partake in making this healthcare system better, right? So we are actively doing that. The other thing is it takes us 3.5 days to address our complaints, and so some take longer than others. But the team does a great job of turning those around timely on average. So to answer the question on how long it takes, we can help you. I know we've got a community, folks are trying to circle around to get your community care issues addressed. So the gentleman that was just speaking, when you guys came in, there's a piece of paper that we gave you that has the green, red, yellow colors on one side, right? One of the things that I discovered when I got here was that the telephone numbers that folks are calling are not the right numbers. Yeah, and so people aren't answering the phone because that number doesn't exist anymore. Okay, there you go. Bingo. So I think there's like 25,000 extensions. And so instead of going through and removing 25,000 extensions, we decided to give you the numbers that are working and that people are answering. So it's hot off the press today. You have a copy of one, ma'am. The gentleman, I'm going to take it from his thing because I don't have one on me. Right here, it looks like this. Right? And I don't expect you to see. You just got eye surgery. She's glaring at it. So on one side, it's got the information specific to this hospital. On the other side, it's got general information for you to decide where you want to get your care at. But on this side, it gives you information like if you wanted to call geriatrics, neuroscience, primary care, mental health, social work. We have commitments to answer these telephone calls. And to the smiling veteran in the back of the room, we also have accountability. So I can now keep track of whether or not this telephone number is being answered, how long it takes them to answer it, and whether or not they're resolving the challenges that you might bring up with them. All right? So the telephones have been an issue, sir, and I appreciate you bringing it up because we do need to fix it. I've called 3 of these extensions one morning just to make sure, and they're working. My team has called 100% of them to make sure that they're working, and we'll begin tracking the accountability, to your point, on ensuring that folks, I don't want to give you any more time just yet, but I'll meet with you individually because I know I've got some other veterans in the room that have a mic that haven't had a chance to talk yet. Go ahead, sir.
Okay. First of all, I'd like to say, Mr. Manager, thank you for your service. Also, I called myself to the information desk, and they didn't know about the meeting. The only way we found out about the meeting is call your office. That's the only way we knew about the meeting. Also, I'd like to know why did you all put the meeting Friday at 2 o'clock? You talking about traffic. Veterans don't want to come down here doing this traffic. First of all, the employees, most everybody is employees. The thing is, the parking lot is full. And my thing is, where's the veterans gonna park? Do you know it took me 40 minutes to get a parking spot out there? It didn't make no sense. So my thing is, Saturday was the best day, veterans would be here. That's why you don't see them here, because they don't want to come and get caught up in the traffic,
Thanks for that.
okay? Yeah, that's what we're trying to do. Put it back on Saturday, you get more veterans.
We got less patients on Saturdays, so we'll work on maybe doing more than just one meeting, though, I think would probably be a better solution. And the parking, I've got my assistant director in the room. We are actively working on that. to allow more parking in the front for our patients and not staff.
Okay, there's 3 other questions that I'm gonna ask you in private, but one other question is in reference to the doctors. You have a few good doctors at this VA, and you got some badass doctors at this VA. Some of them need to get rid of. There's other people's here, receptionists, they need to go too. Some of the nurses, they need to go. And the thing is, you got a hell of a job, man. They put you right in the fire. And so hopefully you can handle it.
Well, sir, I run towards a fight. I don't run away from it.
Amen. Amen. My thing is to you is do what you need to do to handle it because we got a serious issues at this VA and it's not right.
Yes, sir.
Okay, community care. I'm here to tell you, man, community care is the best thing y'all got going here. Because I'm here to tell you, man, I had some issues with my mouth. I had to go to dental. Man, here, over there,
AVC or
AVC, they are swamped. You're talking about 4,000-5,000 people's coming through there. They are swamped, man. You need to get some help over there. That's why veterans can't come over there and get help. And they had to go to community care. If one community care, my mouth be messed up.
So I know some of the gentlemen think that we're blowing smoke or fluffiness. Leadership makes a difference. And our chief of dental is coming to make a difference for us.
Amen.
Okay?
Okay, I'm gonna talk to you.
It's really hard for us to hire dentists. It's really hard for us to hire dentists. I'm gonna say we're doing the best we can, but we're not. We can do better. And yeah, I look forward to talking to you. Thank you. There's a hand raised in the back. Oh, go, sorry. I didn't.
Hello? Okay. Well, I'm not the veteran. My uncle is actually up here taking care of him. But my issue with the VA is that if I wasn't up here taking care of him, he probably would have been dead by now. And also, he's just been pushed away. Like you had your stats up there about the time frame on the appointments.
Yes.
Last year, he did labs and his prostate levels was high. And they already knew that he had contacted prostate cancer from Agent Orange or whatever from the war. And they took care of it years ago, but it came back. But they seen that his levels was up last year, November, I say. They scheduled him an appointment for this year, for July. By July of this year, he was not even walking anymore. He was barely eating. He literally almost died. Then after that, we got him stable enough. He still wasn't walking. Back in, I'll say September, October, they set him an appointment for the oncology here. They called and made him an appointment for December the 19th. Now that's after they confirmed that the cancer was throughout his entire body. He was not walking. He's barely eating. And if I wasn't here to force them to give him an appointment, he would have been dead, which his appointment would have been for oncology, which would have been yesterday, December the 19th. They made it to November the 7th. The oncologist wanted him to come back the next day to do an MRI. They did an MRI. He had 2 big tumors pressing up against his spine, which developed within a matter of 2 months. Because he was just I had to call the ambulance back in August because he was completely down. He was cold. He was almost dead. And he had no tumors in, anything. So by October, or the end of October, November, he had 2 big tumors on his spine, pressing where it had fractured one of his bones on his spine. And the things that I was talking to them about over the phone, like, why is this is not important? Why his health, you don't care about his health? Why he have an appointment way over here and you see that it's a severity? Like, no one cared. No one cared at all because it's no way that they seen his levels up last year and they gave him an appointment in the middle of summer. There should have been no one answering the phone, no anything. And like I said, if I wasn't here to advocate for him or be here to take care of him, he would have been gone because no one answered the phones, no one do anything. It took me almost 2 weeks one time to get him transportation. And then I think like a month or two ago, I was just calling all these 7 numbers for transportation. And then I just thought to call the switchboard. I called the switchboard and I asked her to transfer me to transportation. And before she transferred me, I said, could she give me a direct number because the extensions I'm calling not working? She said, oh, they got a new extension. So when would have known? Because my uncle got to come here on a stretcher. He's practically bedridden now.
So we have a new transportation extension. I'm hoping
It
that,
should be 203, 245.
yes, that's what's on the new, that's the one that worked?
Yeah, that's the one
Great.
that worked.
So this piece of paper, right, this piece of paper is it, right? We can't call old extensions any longer. So I need your help in telling other patients about this. Y'all talk about camaraderie and teamwork and fighting. Where's that at for the rest of the veterans? We're going to start putting this out, and I need your help in ensuring that my team's held accountable. Because you're right. They need to answer the phone. So,
And
sometimes
they
I
don't
just
answer
feel
the
like
phone. And if they do answer the phone, they're getting an attitude, or you on the hold for 40, 50 minutes and somebody just hang up the phone.
Yes.
And you get down here, like they say, you piss them off by getting their attention because they on the phone or they talking about
No.
their personal information. Someone needs some supervision down here that's walking
Yes.
around, checking on these people, making sure they're doing what they're
agree.
doing. Because
agree.
a lot of these people are elderly and they not on the phones. They're not on this app that you're talking about. My
Yes.
uncle don't even know how to work a phone.
That's right.
He do not. He's
I-
just turned 75 years old.
I agree.
So
I agree.
I don't know what's going on and what's the issue. I didn't put in claims. I didn't put in other forms of things. He's disabled, completely disabled now. So we need all these things for him. And I didn't put all these applications in and haven't heard anything back from. It's been a month and a half, 2 months now.
Yeah. Are you a caregiver?
Well, I'm in the process, but I am his caregiver. It's not
All right.
documented.
I want you to speak with them about it. I mean, I've heard a lot of specifics, but again, like I don't want y'all here till 8:00 at night, right? So I know you appreciate it, right? Some of you would be like, well, I'll stay for as long as I need to. Well, that's great, right? But I want to be able to hear from folks and get your answers resolved, okay? So I'm sorry, I know you've hand has been raised for quite some time now.
I have a question for probably social worker services. I am a caregiver of a friend who is in a nursing home, and I have some issues and some concerns with his care. And okay. And I've also talked with patient advocate to make paper trails of the issues that I'm having with the team at the nursing home. And
Is this a contract nursing home?
yes,
Okay.
yes. So I need to get some information on who visits the veterans at these nursing homes, not just the staff to visit at the nursing home. I would like them to visit the veterans to let the veterans know that, yes, someone is looking after me from the VA. Someone knows that I'm here. The care is being done that needs to be done, but I'm on them all the time with pretty much the same issues with his care.
Okay. Yeah.
Veterans who are in a contracted nursing home and the VA is responsible for their care, so if they're 70 or greater % service connected, then they should have a visit every month with their nurse or a social worker. But some people are not out in that, but we still want to hear your experience and see how we can help. So,
Yeah. Thanks for coming in to share that with us specifically. I've got another veteran and a spouse that I'm working with pretty much every day that I share with Kim that has a similar challenge. I think I saw go ahead, ma'am.
Hi, my name, I'm a caregiver, I'm an advocate, and I'm a wife of my husband. I take care of him. However, I've been having many challenges with the caregiver support, the caregivers, things that's going on. We've been denied 3 times. I now have my information. I sent it. Now I'm here because I want to know just why. why, as a caregiver, that I get grief. My husband, health issues has declined. I have written into them and told them that. However, I get a two mailing letters in the mail saying that he's denied, that he's not, that he's doing such and such. And I know 24 hours a day, 7 days a week, I'm taking care of my husband. And not only I had to leave my job, which is causing financial difficulties because I had to leave my job to take care of my husband. He can't be home alone. He's got a loss in an eyesight, and he had it. I mean, he's had it taken care of here, and he don't have sight. Where last September he had sight, now he don't. So all I'm asking is for just a little bit of help, just a little bit of understanding, not putting me off because I'm the caregiver. It's like my husband is a veteran, but I'm not attached just because I'm his wife. I can't answer questions, but however, I'm going to advocate for him. I'm going to stand for him. I'm going to be here for him, but also I'm the caregiver and I need help. That's all I'm asking. I'm not asking to be denied. I'm not asking to hear what somebody else does or what somebody has done and what are the criteria of that. I already know that because I've been consistently calling caregiver support, calling the people that's over there, the social workers, and give the information. And here it goes again. We're back, and I'm back on the same merry-go-round doing the same thing. All I'm asking is because I'm an advocate for my husband, for me as a caregiver to get some help and not be denied for the fourth time.
Thanks for coming in. We've got some experts that can help you. Go ahead, ma'am in the red sweater. Better not pout.
My question is about travel.
About what?
Travel.
Okay.
Travel pay. When you have an appointment to your psychiatrist, why is it that travel gets to make the decision that they don't want to pay you your full pay? They can make the decision when you pass they say you passed a hub. So you could have seen your psychiatrist at this hub. So they don't pay you your full travel. I don't think that's fair because I've been with my psychiatrist. I can't get in where I'm passing at in Lawrenceville. You know, you don't have that many psychiatrists. So what makes travel have the right to pay us the way that they want to pay us? You know, not pay you
Yeah.
full pay.
I don't know the answer to that. And I don't know, do we have anyone in the room that can help maybe? Okay, because I've never heard that one before. I have heard, why do I have to file a claim? And I agree. I think it should be automatic, but we can follow specifically on that one. Yeah.
I mean, because they keep shorting you. I mean, I'm
Yeah.
like, that's not there. And then, you know, I know before, I wasn't paying no copay to travel. But now all of a sudden this year, since we started been coming back, we're paying copays. But I know I've been getting travel for years. I've never paid copays like this. And she says they're looking at 1978 rules. We're getting paid for 1978 pay for now in 2024.
Yeah, I don't,
That's the paper that she
that
gave
doesn't,
me.
yeah, that doesn't seem right. I know the president stopped some of the travel, the copays, and then brought it back, though. Go ahead, sir.
Yes, sir. My name is George Hazlip, and I'm also a veteran. And I served in a combat unit for 4 years. I've served in a combat unit for 4 years, and I got injured, and I had to get out on the medical. Also, my brother was injured in the military. He, can you hear me now? Is that better?
Thank you.
Okay. Also, my brother had gotten injured in the military, he had a stroke, and he had to be transported to Walter Reed's Hospital. And my story is a little different from some of the stories that I've heard, but I have to say, when he was transported to Walter Reed's, we ended up having to relocate here to Georgia. And here at the Atlanta VA is where he received his care. And at the time, I'll never forget her name, Dr. Susan Platt. She's retired now. And she took great care of my brother. She took awesome care of him, and he's alive today because of her care, because of the attention she gave to him, and all of the doctors, the practitioners here at the VA who treated him. So I'm very happy that we were able to get the attention and the assistance that we received from the VA. And my brother still comes here today to receive all the care that he needs. He had to get care from audiology, physical therapy, and he still comes for, he's part of various different programs here at the VA to keep him focused and to keep him active. For myself, because of the injuries I had to overcome, and some of those things I'm still challenged with today, VA is taking care of me. I've been with my doctor for over 20-something years now, Dr. Pan at Fort Mac, and she has helped keep me alive. And that's literally helped keep me alive. So I'm very proud to say, for me and my journey here at the VA has been a different story. And I've also had the opportunity to help a lot of other veterans. And if it wasn't for the VA and all the practitioners that I've been able to, that have been able to help me, I wouldn't be here. I tell some of my coworkers, we should be proud that we have the VA. If it wasn't for them, I don't know what we would do. We we don't have to pay for primary care doctors. We don't have to pay for medicines. There's a lot of costs that we don't have to incur because of the doctors that we have to see. We don't have to pay for physical therapy. We don't have to pay for a lot of things. And Mr. Mincer, yes, you have a challenge on your hands, but I was happy to hear you say that you're willing to take on those challenges and face the fight. But we're here, your staff members. You have a great executive team, and my chief is one of your team members, and she's a fighter. So thank you for being willing to take on that fight. But we're here to help you as best as we can. Just know that my heart goes out to all of our veterans, and I just want to say thank you so much, sir, and to all of you who are on his side, thank you all as well. That's all I have to say. Thank you.
Thanks for sharing. Yes, sir. Thank you. Appreciate that. Gentleman in the vest, a leather jacket. Sorry.
Okay, my name is James Morgan, and I kind of want to piggyback on some of the other veterans that commented, not repeat what they said, but I also got some good service from it, but I also got some service that was not so good. And so, in regards to a little pushback on the gentleman that just spoke of the good service we got, you got to remember, I don't know if he was young enough, he probably don't remember the draft. Some of us was drafted into this. And even if we volunteered, we gave some of ourselves to earn this service, to earn the good service that he said we're getting here. It's not like we giving something. It's on both ends. Some of the people, like you said, Mr. Mensa, you were a serviceman, and we congratulate, tell you we thank you for your service, but also it's to our, we got to remember it's a two-sided thing. And I get good care, but some of the things that happened to me, one incident, and it was going along with accepting what I got. I guess I was outsourced to Emory for some service for urology, and I went there, and they sent for me. At Emory, I was taking the PSA, and it was high, and I kept taking it in. So they said that they suggested that I have a biopsy, and it just so happened I was coming back to the VA for I think to my primary care. It may have been somebody that sent me to take a PSA here. Okay, it's in a month period. It went from 7.68. 20 days later, it went to 4. And I'm saying the Emory was 7.68. Then I came in here. So if you don't know what the PA says, but when it moved from 7 to 4, it makes me kind of give me some alarm now. Not alarm, and I think something wrong. Well, I do think something wrong. Somewhere in between in a month, that I don't think it's supposed to move that far. In other words, one of them is not correct. So I'm confused. So I go to an outside urologist to get some, because I'm scared, number one, and, about the prostate cancer. And so when I went there, they said, okay, even if it was 4.6, I think you as a black male, even if it's anywhere above 4, you need a biopsy. So I had the biopsy done because, like I said, I was scared. So I had it done, and I came back, and I had some costs I incurred. So I went and asked, could I be compensated for? And they told me I need to call community care. And community care kind of said, you needed to come to us before that. So I learned something there, but I'm saying the confusion, and that's not the only time that I've been confused on something. I take several tests, heart, they told me I had a heart attack at some point. Then I went to outside doctor, they told me, they gave me all the stuff, stayed there all night at Emory. I was outsourced, and they told me something was wrong with the machine here, and I wasn't nothing wrong. But I mean, it's still the anxiety is still there from something wrong with one of the machines. I don't know which one it was, but I chose to go on through the heart thing, and I same thing with they used to take the for your annual, they give you a little, well, you have to take what do they call it? A sample of your stool and send it in. And the VA said I had blood in my stool. And then I'm getting ready, then the next day or two, they get me the stuff that you take for a colonoscopy. And so I said, oh yeah, I started taking it then. And then I said, well, I didn't see nothing on here, but I'm taking a call. Then they sent me a letter a week later and told my colonoscopy is going to be in 6 months. And I'm thinking, if I got blood in my stool, so it's the same thing. We echo in what
Yes.
some of the other people say.
Yeah.
But I'm just saying, this causes anxiety.
Yeah.
And I think about it now, and that re-trigger my anxiety. But that's all, and I think it's good side of it. But we earn some of these things. They didn't give them all to us. We earned some of them. So that's it for me.
Yes, sir. All right, there are a lot of experts in the room. They're going to hang out and help with the specific items, and I know there's some folks that want to talk to me, so we're going to wrap that up with thanks for coming. Thanks for the feedback. Thanks for sharing the specifics so we can work on it. Thanks for those online.